Well, greetings, everyone. That was just a beautiful way to start our conversation tonight from the music of Chontay Standing Rock, and we're going to hear more from him later. Love the harmony there. Put me in a good spot. David Knoyer, I'm talking to you from Pierre, South Dakota. How the rest of the country might call it Pierre, but we call it Pierre in South Dakota. And I'm up here for a family event tomorrow. And normally I live in the Twin Cities, and I could have used that music on the drive today because I faced a fierce headwind most of the day. Wow, I think I used twice the normal amount of gasoline in the old pony today. Nice, pleasant, quiet drive though. Good weather. We are here to talk about the current state of COVID-19 in Indian country, and thank you for joining us on this Friday night. I was trying to think what, besides sports events back in the day, what else we did on Friday night. I can remember some of the TV shows on Saturday night that we grew up with, but Friday night's escaping me. So we're glad you're here with us. Lots of news with the pandemic. I think if you were paying attention to the news today, you heard that the federal government is getting very, very close to approving a booster shot, an additional dose of the COVID-19 vaccine for all adults. You might as well make an appointment if you can. I actually got my own booster this very week, and we can talk more about that later, but we're very close to approving a booster shot for all adults. The focus of tonight's discussion is also going to be about the emergency use authorization of the Pfizer vaccine for children ages 5 and older. So the Pfizer vaccine has been approved for children 5 and older. And as I understand it, the Moderna vaccine is not probably far behind, but has not yet been approved. But already shots are going in the arms of young people in Indian country and across the country. I have heard that 1 of every 10 children nationwide has been received this dose. So lots of progress, but also lots of challenges. Coming here in South Dakota today, there weren't a lot of masks when I pulled over at stores and got gasoline and went into the Walmart here. Right, once you hit town, you got to go check out the Walmart. And at the Walmart here in Pierre, not a lot of masks on. So despite the fact that even if you've had the vaccine, you can still pass on that virus to somebody else. Masks are the safe way to go, not just for yourself, but for people that you care about and vulnerable folks. So this is the We Can Do This Indian Country campaign, and we want to answer your questions tonight. And to do that, I want to bring in our first guest. She's a pediatrician from the Grand Ronde tribe of Oregon, and Allison Empey is also the chairwoman of the Native American Children's Committee for the American Association of Pediatrics. Dr. Empey, I know you've been swamped. It's so glad that you're here with us. And in my emails with you, I said, hey, why don't we have your sister on too? Because you and your sister Erica are both pediatricians, and that's pretty fantastic for your family to be able to have that. How are you doing tonight? And I'm assuming you're in the Grand Ronde or Portland area.
Yeah, so nice to be here. Thank you so much for having me. Yes, I am in Portland tonight. Just got home from Grand Ronde Wednesday night, where I practice 1 day a week.
So I'm going to get right down to it. I really appreciate you taking a little time with us, and I know it's a Friday and you've been working probably a 60-hour week, and you're not going to have a lot of time with us tonight. But what has been the impact, as you understand it, of the COVID-19 on children as opposed to adults, right?
Yeah, that is a great question. So I think number one, it's a common misconception that kids can't get sick. We have seen some kids get very sick from COVID-19. I think the numbers are around 8,000 children have been, over 8,000 children have been hospitalized since COVID-19 started. Additionally, we unfortunately have seen some deaths that have happened. And we've also seen something called the multi system inflammatory response in children, or MISC. Which happens after a child has had COVID-19. And it's kind of an immune response. We've seen something like it similarly with something called Kawasaki disease, but it can cause inflammation throughout your body, including the heart, which can be really scary. And then additionally, I've seen some long haul or long COVID in some of my pediatric patients as well. And so I definitely think COVID-19 has impacted us in pediatrics. And I also think about all of the missed school that children have had when they become sick, and having to be out of school for those 10 days. And so I think that's also a major impact on our children.
Dr. Allison, what are you seeing in terms of interest in the vaccine? I'm assuming you put some shots in arms in the last 10 days or so. Is there a lot of interest in it? I mean, nationwide, I think the Secretary of Health and Human Services this week said 1 of every 10 children nationwide already has jumped on board and had the shot. What are you seeing?
Well, we did a mass vaccination site at the hospital where I work, and it sold out or was filled up almost immediately. That's in the Portland metro area. And then, at my tribal clinic, we have vaccines that are available. Um, and I'm seeing a little bit of questions that are being asked, understandably so. But we've been getting some shots in arms for sure.
Why is it important for children to be vaccinated? You talked earlier about they have been sick, they can get sick, it can be quite serious. Why
Mhm.
vaccinate your kid?
I think exactly that reason. I think missing school. I also think about protecting our community, and protecting our elders. We've seen breakthrough cases that have happened with people who've even been vaccinated. And so it's important to think about the spread of it as well.
What What are some of the possible side effects, as you understand it, with kids? When I had the Moderna, the first two shots back in April and May, and yeah, my arm hurt like heck a little bit for half a day or so, and felt a little out of it. This week I had the booster, a little soreness in the arm and a little bit of fatigue, but other than that, my body was okay. What are kids more likely to experience?
Yeah, so the doses that kids are receiving are actually one third of the adult dose. And so, what they saw in the studies, they had thousands of children in the Pfizer study. They actually saw less reaction to the vaccine than we were seeing in adults. So, yes, kids can still have kind of that localized reaction where their arm is sore and whatnot. And then, when we think about um, you know, uh, kind of whole body responses like a fever. We are still seeing some of that as well, but not as much as we saw with the adults.
Are there really any downsides? There's a lot of folks probably sitting on the fence, right?
Mm.
You know, let me hear more, let me talk to more people, let me see what maybe my friends and relatives and coworkers are doing. Are there really any long-term or other downsides to not have your child vaccinated?
What we're finding is there aren't any, long-term, well, in the past year, we haven't seen any long-term um, kind of events from the COVID-19 vaccine that we gave in adults. And I would think, be worried more about kind of the long term effects that we're seeing from getting COVID itself, that long COVID or the MISC that we're seeing in children.
What what about timing this vaccine with other childhood immunizations? Is there a reason to do it all at once, or are those separate issues? Because I know when you look at
Mhm.
if you look at the long list of what kids, measles, mumps, and rubella, et cetera, how does this compare to that list, and should they schedule it all?
Well, luckily, a lot of the childhood vaccines are completed by 4 years of age. Um, so we're doing the 5 to 11 years old, but actually, they can receive routine childhood immunizations at the same time that they receive the COVID-19 shot. I got my flu shot in one arm and my COVID-19 booster in the other arm when I went in and did it. And so we are offering, if kids are due for multiple vaccine at once, we are offering, along with getting maybe your Tdap and HPV, let's also get a COVID-19 immunization with that too.
What's the Tdap?
Yeah. Oh, sorry. That one protects against tetanus, diphtheria, and pertussis or whooping cough.
And I know HPV just because I met Naomi Lee in the last couple of years, and you probably know Naomi, who's worked on that vaccine with a human
Mhm.
papillomas virus. I know, forgive my
No,
Latin there.
it's okay. Human
And I
pap
have two daughters. I have two daughters who I believe have had that.
Actually,
Uh,
it's for boys and girls now. But yes, the human papilloma virus, and we usually recommend that one, starting as early as 9 years of age. So that's hitting our
so
target population now.
stepping back, I mean, what general questions are you getting the most these days? I mean, lots of people are still unvaccinated. Like 60 million people, I think, in the country are remaining to be vaccinated. I've got family members who aren't
Mhm.
vaccinated. Uh, I've got a fairly close relative who got sick from COVID and had to quarantine and had lost his smell and taste. Right. So,
Oh.
what are you hearing from people, and why are people not getting vaccinated, as best you can tell?
Some of the questions that I have heard have been, I think I already had, or I know I had COVID-19. Why do I still need to get vaccinated? And I, usually let them know that I still recommend vaccination, even if you've had COVID-19. Um, And the reason being is that we are not sure how long you have immunity after you have the virus. Um, and there have been some studies that looked at antibodies after you had the COVID-19 vaccine, looking at people who had re- COVID before and then people who'd never had COVID before. And they saw a boost even in people who'd had COVID before in their antibodies. And remembering that antibodies are what we look for after you've seen a vaccine to make sure that your body responded to the vaccine and is ready to fight that virus when it's exposed to it.
How's how are you and your coworkers doing with this? I mean, when you read, right, when you read about this, I mean, we're all on Facebook, right, and there's memes out there, and there's stories about health providers kind of being exhausted. A lot of some hospitals, right, are turning away regular patients. A Facebook friend of mine whose family member had a pretty serious brain aneurysm,
Mm.
um, was in the hospital for weeks, and then transferred to rehab. Had a a setback, in the hospital that she was at before couldn't take her back anymore because they didn't have a bed. So then she had to go to a different hospital across town that didn't know her case, right? So, and then we're reading about just fatigue, right? And kind of people quitting, you know, I've just had it, I'm done, right? What's it been like for you, and how, I mean, it's been a long time now, and it doesn't seem in some days that it's gotten much better, but maybe in your case that's not true.
Well, I'm gonna be honest with you.
Please.
um, it is it is hard right now to be a doctor. It's probably been some of the most trying times. I haven't been practicing that long, but in the short time that I have been practicing, it is, yeah, I think we're tired. A lot of us are tired. And, like I said earlier, we have seen some deaths in pediatrics, but not nearly as many as they have seen on the adult side. And I really feel for a lot of my adult colleagues who day in and day out are dealing with death. And it's just so much more than we've ever had to deal with and grief. I think it really has affected us for sure. And so I know that I feel lucky because I have family members that I can talk to. Like you mentioned, my my sister is a doctor, and talking to other colleagues about patients that we've lost, and for a lot of doctors, it's not just patients; it's people in your community that you care for, and so um, yeah, it's been tough.
Thank you, doctor. And we're just very grateful for your time tonight. When you Google native pediatricians, there aren't too many that pop up, and so you're very precious to not only your tribe there in Grand Ronde, but to all of us. So thank you for your dedication, and thank you for your time tonight. You talked about this immunity that kicks in after you've had COVID,
Mhm.
um, and we don't know how long that lasts.
Mhm.
Um, and there's some people that I've heard that are just waiting for the vaccine because they figure, or not to get the vaccine because they figure, oh, if they get sick, then they'd rather have that kind of immunity rather than this the vaccine in their bodies. What do you say to folks that are thinking it's better to wait for that rather than just get it now and have this protection immediately?
Yeah, I think I talk a little bit about, the how sick you can get from COVID, how we don't know how, each person will react to getting COVID when they get it, and some of the long-term effects you talked about. Someone you knew, losing their sense of smell, and that's, can last for months and years, maybe we don't know yet. Um, and so I talk a little bit about that. And then um, The other thing I talk about is, how a immunization works. It's helping your immune system. It's I've heard a lot of people say like, "Oh, I got a good immune system," and I really just think about the immunization as being a helper to your immune system so that you can fight that virus even better.
Absolutely. What you're I'm assuming at the clinic you're seeing children. Um, these kids are around, elders, and they're around other kids at school. They're
Mhm.
bringing, I had young kids, and there was the sickest times, right, were when they were first went to preschool and they brought pink eye home and all this other stuff, right? And it's what happens, right? And maybe with masks there's a little less of that, but it just seems to make sense if it's safe to get kids vaccinated. Is it that simple with folks?
I hope so. Because, that's how I see it too, is helping protect, our community, protecting our elders, caring about other people, and caring about, there's still kids who can't get immunized right now. If you're less than 4 years old, you can't get immunized, babies. Um, so, I hope everyone sees it that way. And as we get more vaccines approved and we start vaccinating more people, I think it's been. I think I talked a little bit about how tough it is, but there's also a lot of hope. Um, and so I'm really hopeful as we start to see more kids, missing less school, um, and more activities hopefully opening up soon, and then the vaccine for kids less than 4 years of age.
Here's a question on the screen, Dr. Empey. Is it an immunization or a vaccination? Is it the same thing? This says, I understand that an immunization prevents a person from getting the virus. A vaccine mitigates the symptoms. Is there a difference there?
Yeah, that's a great question. We have been using them interchangeably. They're actually the same thing, a vaccine and an immunization. Um, and how I think about the mRNA vaccine, which is Pfizer, which was approved for kids working, is that the immunization actually carries a little bit of the mRNA, which is a messenger RNA. And I almost think about that as uh, let's see, a recipe, if you will, a written recipe that your body, your cells in your bodies take, and they can read that recipe and create basically a protein that appears on the virus. And then your body sees it's called a spike protein. Your body sees the spike protein. So, not the whole virus, but just this little piece of the virus, and it creates antibodies against that spike protein. And that way, when your body is exposed to the virus with those spike proteins on it, it already has antibodies to help fight um, coronavirus.
So thank you for that description. So it's still possible to get the virus, and it's still possible to get sick. But what the vaccine will do is lower the chances of getting the virus and lower the harshness of the symptoms. Yeah.
Yeah, so the childhood vaccine they found is about 90% effective against preventing any symptoms from COVID.
Well, Dr. MP, thank you for your time. Is there what final thoughts would you like to share with us before we let you go?
Get some shots in arms. No, I think, if you have questions, if you have concerns, please talk to your pediatrician or your family medicine or your nurse practitioner, PA provider. We are all willing and wanting to talk to people who have any questions about vaccines.
And there's more information at vaccines.gov. And there's more information at We Can Do This, hhs.wecandothis.gov as well. Dr. Empey, thank you so much for everything you're doing for your tribe and for your family and for Indian country. And I hope maybe we can get you again on one of these discussions in the coming weeks. But I hope you get a little rest tonight and take care of yourself.
Thank you so much for having me. It was so nice to be here.
Good night. Well, as I mentioned, this is the We Can Do This Indian Country campaign. And it's about having a conversation with folks, right? We're not here with, we know best. We're not here with, why haven't you done this? We just want to have a conversation because it's about the circle, right? It's about keeping the circle strong. And we're all part of the circle. We're all part of the circle. I didn't get the booster vaccine this week, just for me. I got the booster vaccine so that in a month from now, I can go see my near 80-year-old parents with a little more peace of mind, right? My father's diabetic. My mom is in pretty good health, but my dad has been in and out of clinics and hospitals, and uh, they've both had their vaccines. And, the last thing they need is to catch COVID. And so I'm just doing that for them, right? So I thought long and hard about doing it, and it was very, pleased to be able to get the booster this week. I think ahead of the curve, right? Because as I said to open the show, the federal government, the FDA, the CDC is this close to approving a booster shot for all adults. So you might as well make your appointment and do that. We Can Do This .hhs.gov and vaccines.gov are two sources of great information. This campaign is from the Department of Health and Human Services with partners such as the Indian Health Service, which has already gotten vaccines to thousands of children as we speak. The Indian Health Service, HHS, local partners such as the Rocky Mountain Tribal Leaders Council, just to promote these conversations, right? It's about conversations and asking good questions to help folks understand and make choices on their own behalf. The campaign has had posters, flyers, some radio spots, and some social media ads. And I just want to give you a taste of a previous social media ad that features the voice of Superman, who's a pretty well-known performer from Southeast Montana, Crow Reservation. Superman blends hip hop and tribal culture, and you've seen him dance powwow style. And I believe right now he's on the road touring in places from California to Minnesota and beyond. So let's just have a quick taste. Got to pay attention now. This is a quick 15-second spot, but gives you the energy of some of the pieces of this We Can Do This Indian Country campaign.
Honor our past, be influenced by those who came before us, and rise to make a difference. It's easier than ever before to be a modern-day warrior. Let's get vaccinated so we can get back to making history. We can do this.
We can do this. Superman. Let's bring in another guest. And we're talking about Indian country tonight, but we're having a little focus on the Dakotas and Montana. I'm talking to you from Pierre, South Dakota, and I wanted to bring in Ruth Buffalo if she's available. I'm not hearing if she is. So before we bring in State Rep Ruth Buffalo from North Dakota, let me play for you a part of the presentation that Dr. Anthony Fauci of the federal government made to the White House summit for tribal leaders this week. Now get your pen and pencil ready, because this gets pretty detailed about some of the more technical aspects of the whole pandemic. And Dr. Fauci spoke right after Secretary Javier Becerra at the first day of the Tribal Leaders Summit this week, and he talked about how the pandemic is still very, very, very negative in Indian country, which has by the highest rates of hospitalization and infection by population. So let's watch. It's about 5 or 6 minutes with Dr. Anthony Fauci.
As you can see from this slide, the United States has been very severely hit by this historic pandemic, making this the worst outbreak of a respiratory illness that we've experienced in well over 100 years. This is a slide showing the various surges that we've experienced since the winter of 2020, 2019, 2020. I want you to focus on the right-hand part of the slide where you see where we have peaked from the summer surge and have coming down. However, over the last few weeks, we're seeing a plateauing of cases at around 70,000 per day, an unacceptably high level, and I will get back to that in a moment when we talk about boosters. For those who get symptoms, and about 30 to 40% of people get no symptoms, but for those who do, about 80% are mild to moderate, and about 15 to 20% are severe to critical, leading to a variable case fatality rate of anywhere from 2 or so percent up to close to 20% in people who require ventilatory assistance. Among the individuals who do get severe illness, they are very heavily weighted towards the adults, mostly elderly individuals, and people at any age with certain underlying medical conditions. Because those who get severe disease and have a strong propensity to that, it is almost always related to the underlying medical conditions that they have. They're listed on their slide, but prominent among these is obesity, diabetes, hypertension, chronic lung, and cardiovascular disease. Unfortunately, these are conditions that are much more prevalent among the tribal nations as opposed to the general population. Now, for those who get manifestations of severe disease, it's a wide spectrum, dominated by the acute respiratory distress syndrome, but also there are neurological, cardiovascular, and kidney involvement, as well as a hyperinflammatory and hypercoagulable state, leading to multiple organ system dysfunctions. Look at that top red bar. American Indians and Alaskan Natives clearly dominate that picture, even more so per 100,000 population than African Americans, Hispanics, and Asians, and certainly Caucasian populations. Again, a double jeopardy of vulnerability. There are therapeutic interventions that can prevent you from going to the hospital. One is to target the virus. The other is to moderate the host response. For example, when someone has an aberrant inflammatory response and we treat them with common steroids like dexamethasone. But to target the virus, we have one FDA-approved IV drug called remdesivir, other antivirals, particularly oral ones, that are now being tested, and a whole group of monoclonal antibodies. If you need monoclonal antibodies, there's a Combat COVID Antibody Call Center, which you can get merely by calling this number or going online. And these are the list of the 3 vaccine platforms, the 6 companies, and their status. As you know, we now have one vaccine, the Pfizer-BioNTech, getting full approval, and 2 of them, Moderna and J&J, getting an EUA. What is the status of vaccines for children? We now have EUAs, or emergency use authorization, for Pfizer from adolescents 12 to 17. Again, we have an EUA for children 5 to 11, very recently given. And now we have other approaches towards getting enough data to see if we can even vaccinate younger individuals. The results are really impressive. If you compare a vaccinated person with an unvaccinated person, in the era of Delta, you diminish by 5-fold at least the likelihood of being infected, and now recent data by 10 to 15-fold the diminution in the risk of hospitalization and deaths. These vaccines are safe. 7.3 billion doses have been administered globally and over 435 million doses in the United States. However, there's a challenge now, and the challenge is the Delta variant that has a much greater transmissibility than the Alpha variant that we were dealing with several months ago. This brings up the issue of a booster shot. The red bar is the rate of confirmed infection per 100,000 in those who were not boosted. The blue bar is the rate of infection per 100,000 in those who were boosted. When you look at the unvaccinated in red, that's the infection per 100,000 of severe disease in individuals 60 or over. The blue is if you've gotten 2 doses, but look how low the boost gets you. The message I'm getting to you is that boosters will soon very likely be available for everyone. And I encourage the tribal nations, particularly those who've done so well, as the Secretary mentioned, in getting people vaccinated in their primary vaccination. When the boosters become available, get them. We are in a race with a formidable virus. We have the tools, highly effective, safe tools. If we apply them, both with primarily getting vaccinated and with boosters, we unquestionably will win this race against this formidable opponent.
Dr. Anthony Fauci speaking at the all-virtual Tribal Leaders Summit this week. And let me bring in now State Representative from the state of North Dakota, Ruth Buffalo, member of the MHA Nation. Ruth, I'm down here in Pierre, and you're often in Bismarck doing business. And thank you for all the work you do on behalf of your constituents, and thank you for taking time to join us tonight. Are you from the Fargo area? Are you home, or where are you sitting tonight?
I'm proudly representing District 27, but we are in Minnesota. My daughter is playing junior college basketball and has a game in the cities tomorrow. So my family and I, including my mom, who surprised us today from Mandaree, is with us. So we're at St. Cloud actually right now.
Oh, we could have done a house swap. I left town to come to. There's a memorial for a family friend tomorrow up in Cheyenne River, and I drove over to Pierre today, and oh my gosh, I just drove, and it was so windy today. It took me forever. And but thank you for joining us, Representative Buffalo. What's the status of COVID-19 in your community right now as we speak?
Well, being a citizen of the Mandan, Hidatsa, Nurkara Nation and originally from Mandaree, I was visiting with Kathy Eagle earlier today, and she's the CEO of the Elbow Woods Memorial Health Center, and she was sharing a little bit about what's happening on the ground in Fort Berthold. And what she has shared with us is that right now COVID is very well alive and well. It's actually worse than the first surge. A lot of the age group is that they're worried about right now is the 20 to 30-year-olds who aren't yet vaccinated. It is hopeful, she said, that now that the younger kids are able to get vaccinated, but there's still concern with, grandkids being with their grandparents, which is hard to part the two from each other, and being in a lot of multi-generational families. That's also a concern back home, but on Fort Berthold Indian Reservation, they have done a lot of vaccines and testing. I know one time when I was going back to Mandaree this past fall, they had checkpoints as you entered in, you gave your name and your purpose and who you were going to visit. So I thought that was really good to see. Cheyenne River really led the way early on in the pandemic in protecting their borders. And so Fargo, being the largest populated town in North Dakota, we are still seeing an increase with COVID infections, and also hospitals are being strained. And so it is still concerning. November 19th in 2021, and we're still seeing an increase in COVID infections. Myself, I just recently received my booster last Saturday. Our 7-year-old twins also received their first dose of the COVID vaccine. And then we also received our flu shots on top of that. So that's kind of a little bit what's happening in our household and then locally, and also a little bit about what's happening at MHA Nation.
How did your 7-year-olds do with the needle?
They did really good. There was about 800 people that went through the clinic that day. And so we were able to leave and come back and bring our college freshman with us, to make sure she got her flu shot. But the twins didn't miss a beat at all. Myself, I was probably the only one in our household that got a little wiped out from the booster, but I'm fine.
Yeah, it's kind of how I felt too, but I'm a poor, pitiful Indian male, so you're not surprised by that. Be careful there in Minnesota. For some reason, Minnesota is one of the hot spots, and that's normally where I call home, and that's where our media partner for the We Can Do This Indian Country campaign, Native Roots Radio, is based. So mask up and be careful. Normally, folks are careful there, so I'm not quite sure what's different this time. But avoiding crowds, right? I don't know. Some of these basketball games, be careful.
Right. Yeah, we'll definitely be, wearing masks. And we have my mom with us, who is an elder and has underlying health conditions too. So it's always an added level of anxiety in wanting to protect our, the kids as grandma, my mom. We lost my mom's only living my mom's only living sister, my auntie Hope, last December. Early December. So it's definitely still very just a heightened level of anxiety that we have when we go into public spaces, knowing that, we want to make sure we're protecting Grandma Maxine. So.
Yes. And it's such a small world. When you mentioned visiting was with Kathy Eagle. Was that her name?
Yeah.
Just flashed. I remember Ryan Eagle. I don't know if they're related or not, but Ryan was, I think, student of the year at the tribal college one year, way back when.
Okay.
And yeah. And I remember that from another project I was working on. And it's such a small world. This memorial I'm going to tomorrow is, part of the Fredericks family. I don't know if you know Michelle Fredericks and those folks, but so it's a small world we have here in Indian country. Now back to your putting your political hat on, right? It seems so funny. You mentioned this surge, Kathy Eagle telling you at the hospital there at MHA, it's just as bad as it was, last time. Right. And now we just heard Dr. Anthony Fauci talk about these tools, right? We know what we can be doing, right? Before we were just masking and keeping away from each other and washing our hands, and we didn't have as much information. And now we have this vaccine, and the surge is happening again, right? I think one of the European countries, Belgium or some ways, is thinking about a total lockdown again, right? Is it? And some places are talking about, get a vaccine, but I'm not going to make you get a vaccine. I'm pro-vaccine, but mandates don't work.
Right.
What do you think about that?
Well, just coming off of our special session last week in Bismarck, the governor called us back in by executive order, solely to focus on, the disbursement of the ARPA funds, American Rescue Plan Act funds, and then also to vote on the new redistricting maps. However, there were a few other bills that got introduced through the Delayed Bills Committee, and a lot of them were anti-vaccine mandates, and of course the ban on critical race theory also. And all of those bills passed during our special session. And the common theme for the anti-vaccine, legislators don't want to have, they want a ban on vaccine mandates. And so primarily it was to protect businesses. And so in North Dakota, there's a lot of different data out there, but this one right here, it is North Dakota, 433,341 people, or 56% of the state has received at least one dose. Overall, 368,413 people, or 48,000 of North Dakota's population, has been fully vaccinated. And then also there's, more information on our website in North Dakota, the health.nd.gov/COVID-19 vaccine/dashboard. So North Dakota political landscape is very red. We're a trifecta where the governor and the majority of the in the House and the Senate is held by the same party, which is the Republican Party. And so there is great resistance in our state regarding vaccines and mandates. In fact, our governor had joined, I think, at least 5 other states in a lawsuit demanding that they do away with the vaccine mandates, and actually, quote unquote, referred to Biden's vaccine mandate at the federal level as being very misguided. So,
wow. We did have a speaker on a conversation a couple months ago also talk about, how nobody likes to be told what to do, right? However, when you look at the data, right, and you look at who's getting vaccinated and who isn't, and what happens to those folks, Dr. Fauci, as you were probably turning your computer on, we heard from Anthony Fauci a few days ago, and he talked about these studies from Israel, right, that have looked at the waning efficacy. Basically, the shots kind of lose their effectiveness, right, which is making the case for the booster. And so once you get that booster, the data from the study in Israel, right, shows that, it's many, many times more likely if you don't get vaccinated that, you're going to end up sick, you're going to end up extra sick, or you might end up hospitalized, and just a tiny possibility of of that happening to you with, after the booster. So you look at that data and you're like, who wouldn't do that? Right? Who wouldn't do that? But we have folks in our families, we have folks across the aisle, we have folks, in political positions that think differently than you. How do you start a conversation with folks like that?
I think just, trying to humanize the issue, talking about our loved ones. I was out in Valley City yesterday speaking alongside Nick Archuleta from North Dakota United, and an elderly gentleman came up to me after our talk and shared that he had a mishap. He fell and broke some ribs and then found out he had COVID. But he had shared that he believes he's immune to COVID as well. So just very interesting, like you mentioned, broad spectrum of different beliefs out there, but I believe humanizing the issue, and really we shouldn't wait until it affects us directly or impacts us directly. We should already be trying to help protect our neighbors and people that we don't even know, because this is real. And, during the pandemic, I know we all have stories, of families and friends who have lost both parents way before their time. And so I think that's probably a common theme for many of us who have public health backgrounds. I went through the NDSU's American Indian Public Health Specialization in the Master of Public Health program. But a lot of what prompted us into this field was that we lose so many of our relatives prematurely. We have such high rates of premature death in Indian country. We have low life expectancies. And so, I didn't get to meet my grandparents. They passed away a year before I was born. And so that's a lot of what has motivated me into public health and trying to work towards prevention, and how do we help people live longer? How do we help people improve the quality of life for everybody? So I think really just humanizing this issue and trying to find common ground, because we all have families and we all love our families. And so how do we translate that and navigate, very very different spaces where many people are depending on us and our voices in those spaces to speak up for them and to, just ask, like beg and plead, please, please protect yourself, protect each other. It's just something so simple, but, conspiracy theories or misinformation really are running rampant right now. So it's tough.
Well, thank you for your time, Representative Buffalo. And before you leave, you talked about your public health friends, and I believe it's so cool what's happened in North Dakota State, UND. Lots of Native Americans have gone through public health and other, natives into medicine and all sorts of programs up there. And I believe Tasha Peltier. Let's bring Tasha on. I think you two have, who knows where you two have conspired in your past or current lives. How do you know each? How do you know Tasha, Ruth?
Through Master of Public Health program. I believe she was probably, started a year before I did. I transferred in from KU Med Center. And so, yeah, that's where I met her, I think, through the MPH program.
Well, nice.
Yep.
Kay, you were down in Kansas, huh?
Yeah, yep. My husband's from Kansas. So,
Tasha, you want to do a quick introduction or say something to Ruth before we lose her to the basketball tip-off tonight?
No, good to see you. Good luck to your son and his team, and keep up the great work.
Thank you. Yep, it's our daughter. She's playing junior college. So.
Oh my goodness.
Yeah.
Good luck.
Thank you. Good to see you.
You too.
Good night. Thanks, Representative Buffalo.
Yep. Thank you, Madzigaduds.
Well, Tasha Peltier is from the Standing Rock Sioux tribe. She's Hunkpapa Lakota, and you heard a little bit about her interest in public health, wife and mother, and she's the co-executive director of the Minnewachuny Health Circle, a nonprofit on Standing Rock that is working on public health and probably from a more holistic, people-centered perspective too. You've worked for the tribe as a COVID-19 contact tracer, and you've been pretty involved with the pandemic. So it's awesome to have you and your perspectives here, Tasha. Would you like just to say any more about yourself?
No, I think you pretty much summed it up. I, wear a lot of different hats, especially, after receiving my education in public health. It really kind of expanded the horizons for me. And, when the pandemic hit, that definitely, I felt like that's where I needed to step up and really help in my community. And so that's how I ended up working with the COVID team and helping to kind of build the capacity locally there.
How was that experience, and has it waned a little bit? I mean, it definitely felt like, right, this fighting the unknown, this alien that sort of dropped in, us against the universe. And now after, more than a year, we talked earlier with Dr. Allison Empey from the Oregon, the Grand Ronde tribes, and just a lot of fatigue, right? But what's going on there with some of the people that you've worked with at Standing Rock and fighting this pandemic into year 2 and 3?
Yeah, I definitely think we've come a long way. I'm not serving in that role anymore, but I know one of the things that was really evident was that we didn't have the capacity to handle something like this locally. I think across the nation we saw that, but just locally we didn't have the infrastructure to, to monitor the data, to do some of the things that we needed to do to monitor an infectious disease. And so now we're seeing, I'd say a year later, we've I think they really have things, a lot of processes in place, and they're able to respond more rapidly. So we're still seeing cases locally. Of course, the pandemic is still here. We definitely the rates are a lot lower than they were at the same time last year. I think one of the challenges that we've seen in our communities of Standing Rock is our low vaccination rates. We are sitting right about 30, prior to the approval of the pediatric doses, we were sitting right about 30%. And I think, there's various reasons why that number is so low. There are still some people, quite a lot of people that are on the fence that, just aren't really, they're saying, I'll be careful. I'm going to wear my mask. I'm going to, do all the things that I need to do to protect myself. They just don't trust to take the vaccine. And so I know that locally there's been a lot of education that has gone out by, healthcare providers, the local IHS, tribal health, CHRs. A lot of people have been working really hard to educate the community on the importance of getting vaccinated. We've, our nonprofit locally too, just kind of tried to hold some conversations, find some local champions, pull in the youth, try to get their perspective of what are their, what are you, what are you afraid of? What are the things that you're hearing? What's making you not want to get the vaccine? So just a lot of really good things happening, but we didn't see the needle move a whole lot on that. I do know there have been some successful efforts in some of the entities across the reservation. For example, the schools gave incentives, which I think is necessary in times like this. I heard you talk a little bit about mandates and whether those kinds of things are necessary. But on the flip side of that, I think incentives are another public health modality, I guess, or method to help people make the right choice. And so we've seen that work locally in our casinos, our schools. So we know that I don't know exactly what the rates are, but I believe the casino, that brought it up to over 70%. So they had 70% of their employees vaccinated after giving an incentive. So I think hopefully we see some of those efforts improve those rates within our communities.
And what are we talking, like a gift card type incentive, or?
It depends. I think cash for sure. So like the casino employees got $3,000, I think was what their incentive was. So really, and I do believe that was COVID relief funds that they used for that, which I think falls in line with the intent of those funds. I mean, I think anything that you can do to mitigate those risks are on the table. And so I do know that it's hard. You hear sometimes local leadership will put a lot of emphasis on individual choice. People should make those choices on their own. But when you talk about sometimes there's just not that motivation. They maybe haven't been touched personally by COVID or haven't lost somebody. It just makes it a little bit more difficult to make some of those decisions. So, and if there's fear too, that makes it more complicated.
Right. Well, and it's easy just to sit at home or, just sit back and complain. I mean, hey, we all like to complain. And there's certainly I can't even barely pay attention to the news anymore, right? There's so many crazy things happening, and Representative Buffalo talked about conspiracy theories and all this stuff that I just I see the headline and I almost know the rest of the story, right? So I'm just like, you definitely tuned out. But I was saying earlier, I got the shot and I got the booster for my parents. I'm in my 50s, they're in their late 70s, and right, no shot, no holiday, right? I wasn't with them last winter holidays, so this year, hey, we're looking forward to that. But not everybody in my family has been vaccinated, and so those are some awkward conversations to have, right? With, well, don't hug grandpa, right? Or we can try to eat, in a more ventilated area, but it's not a simple conversation. And I can't believe that you can't convince anybody to take their medicine.
Right. And, I think some of that I've recently, been kind of listening to different tactics. And, I think in the beginning, we put a lot of emphasis on, things like our Lakota and Dakota values of being a good relative and, doing what's right for, the better good. And I was reading an article about how that really turns people off. When you shame them. I think our people use shame a lot, into keeping order and keeping, helping people to act right. But I was reading an article about, that's not as effective in trying to help people to change their mind, when you shame them. And so that was a little bit of a shift for me, because I think traditionally that's how we did convince people of things. But yeah, I was reading, that really motivational interviewing and asking them, kind of prodding into what is going on in their mind. What are they thinking? What are they afraid of? So those are different conversations I've had to have with people too, just to learn more about what they are thinking.
That takes time, right? If you're a nurse or if you're somebody at a hospital, you don't have 20 minutes to have a conversation like that with people, do you?
Right, exactly.
Um, I really appreciated you talking us through these different ideas in the community with youth and what about Dr. Empey talked about having this clinic with 100+ people that showed up. Are they bringing, you think, the vaccines to the schools for the kids, or or do you have to go to the clinic at Standing Rock to get the vaccine? How is the access changed at all a little bit?
No, I think one thing that's really great is that the public health nurses are going to the people. So we're seeing that with the pediatric doses, they are going out to the schools, much like has been mentioned already. Is they're going to give them an opportunity to get their COVID vaccine, but also catch them up on all of those shots that they may have missed out on through the pandemic, or with decreased access to the clinics. I think a lot of our kids are falling behind on some of those other shots that they need to have. So they are going out into the schools, which I think is the most effective way. We're a very large reservation. I think our reservation spans about 2.3 million acres. And so when you talk about and we have one facility on the North Dakota side and one facility on the South Dakota side of our reservation. And so sometimes that's difficult for people. It may be 30 miles and that could just as well be 600 miles for some people. And so it's really important for them to meet them where they're at. And that's really what the local facilities have been doing. So I'm really thankful for that, because that just will encourage and help them to be successful in their efforts too.
Well, while I still have you here, Tasha, just because this is exactly the type of work that you do too, I'm curious about your reaction to this. But let me ask our partners behind the scenes at Native Roots Radio if they have possibly one of those radio spots queued up that really is about having conversations with folks that have aired in the past few months, but a part of this We Can Do This Indian Country campaign, people at home having conversations about the pandemic, about the vaccine. Let me see what we might be able to play and get your reaction to it, Tasha. Hold on a second.
I love making and sharing things I cook with my family. Before the COVID-19 pandemic, my grandkids used to come over every Sunday for dinner, but now it's just Grandpa and me. Vaccines are here and can help protect us from the virus. I plan to get the COVID-19 vaccine, not just for myself, but for my family, and to be able to share what we love with each other again.
We can do this. Learn more at cdc.gov/coronavirus. Brought to you by the U.S. Department of Health and Human Services.
Well, that was just a taste of some of the creative spots that G&G Advertising has put together a part of this campaign, We Can Do This Indian Country. It sure helps to have authentic voices, right? No matter exactly what they're talking about, Tasha, right?
Right. And I think the other important thing in that clip is, highlighting the importance of the things that are important to us, right? That intergenerational relationships, those kind of interactions that we treasure, right? We love sharing meals with our, elders or our parents, or we love having opportunities to sit and visit with them. And that was one of the things that I think was most devastating for families, our Native families during that time, as we weren't able to do that like we, typically would. And so I think that was a great piece.
Well, thank you for listening to it. What's your understanding of this? When you go to our communities, for the most part, right? It's children, right? And a bunch of teenagers, and a third or more of the population younger than 21, lots of kids on Standing Rock. What's the situation in terms of getting the vaccine pretty much to everybody in school, right? The Pfizer vaccine anyways. What's happening there around that you understand?
It's so new. It's been so new since it's been rolled out. I don't know what the rates are right now. I think the overall rates, it hasn't really changed the number. I think prior to the pediatric approval, it was right at like 30% I think it went maybe up by 3%, but it's so hard to judge what the actual uptake of the pediatric doses are. I know one thing that we did see is that when we were looking at the data of who was not getting vaccinated, it was a lot of our young people. So the 18 to 25-year range. They were the ones that were a little bit more resistant to getting vaccinated, and so the elders that are more at risk, they're taking their taking it seriously because they're at of course at higher risk of developing complications. And so our young people just really are having a tough time seeing the role that they play in preventing additional hospitalizations and deaths. So I'm hoping that with our younger school age kids, I'm hoping that we see a larger uptake in that age group. I know myself as a parent, we were excited. I was uncomfortable for a long time, that for the fact that myself, my husband, our older 2 children were vaccinated, and we have a 9-year-old that was not yet vaccinated. And so now that he has the opportunity to be vaccinated, I just feel a little bit more relieved. I think that we've heard a lot of conversations about, well, kids don't get as sick or, but I know Dr. Empey talked about some of the things that I was concerned about, some of the long haulers or the long-term effects that maybe we don't even know about yet, of kids getting after they get COVID. And so, and then not only that is that I know, our kids, we've always known they carry germs, right? They get, if they get sick, they share everything. They, lick things they're not supposed to. Their fingers are in their mouth. And so it's really easy for them to kind of carry those things and spread them to other people. And so, that was also a worry of ours is, that he, goes to school. And so, we worried about him, possibly transferring it to somebody else if he did get it. So now that he has had his first dose, he was really excited too. I think that was one of the more impressive things is that he just couldn't wait to get it. He doesn't like getting shots just like everybody else, but he just really was excited to step up and do his part. And so I thought that was really exciting for us as parents to see him doing that. So
What is he, a 4th grader?
Yes.
The golden years, right? So
Right.
cute. So
He,
cute.
He didn't, and it was kind of funny because so he got it, and then my husband got his booster the same day, and my husband was laid out, and he just, our 4th grader bounced up and went to school the next day and didn't even skip a beat. So it's just kind of funny.
He must have got your side of the family, huh?
Yeah.
The kid. Yeah, I was just kind of tired, but the shot itself hurt more this time for some reason. I said, God, is that a number 2 pencil going in there? But who knows, who
Sometimes
knows?
it's the user technique too of how they give the shot to and where they give it.
Oh yeah. I'm going to go back and talk to her. Well, Tasha Peltier, thank you so much for everything you do. Tell us more about your nonprofit, Mini-Wauchoni Health Circle. How long has it been around? And it sounds like, you sound like you've been in business forever, but it's not been that long, probably.
No, actually, so the organization was kind of started during the NODAPL camp when they were providing kind of holistic, services in camp. And so when camp, when everybody went home and it was done, there was a group of organizers that wanted to continue the work. And so myself and Elena Eagleshield are both from Standing Rock and both have public health backgrounds. And so we were approached and asked if we wanted to be to help lead this. And so we've been doing that since 2019. And, we don't have physical space or anything, but just doing a lot of really great things in the community with trying to promote health and wellness that's rooted in our traditional ways of thinking and being. And the pandemic really highlighted that. We saw people utilizing our teas, our medicines to try to, help keep themselves safe, but also to help them manage symptoms if they did catch COVID. And so I just think it just highlights the importance of us really uplifting some of that knowledge that we know has been in our communities forever. And so, yeah, that's a lot of the work that we do. And I'm excited to be here today, and thanks for having me.
Well, and it's so cool. You talked without even, any prompting, just about how comprehensive and how multiple, right? There's not a silver bullet, right? There's not a magic wand. It needs to be multiple things and coming from every direction and at untraditional times or unconventional times, right? You could just be visiting with someone, at their running car outside the store, and who knows what that conversation could turn into, right?
Exactly.
Well, thank you for all your time on a Friday night. What's happening now with you and your family? Are they making, it's kind of late for dinner? Do they cook for you?
We actually are having a strategic planning session for our organization. So we have a house full of people, and they have dinner waiting for me. So
leave it to Indian women working on a Friday night strategic planning.
Yeah.
Thank you so much for your time.
Thanks, guys. Have a good night.
Tasha Peltier, Minnewachuny Health Circle, Standing Rock Nation. Very interesting, and so many of our communities have lots of innovators like that. And she said they don't even have an office, right? But they can still make it happen, right? You don't always don't have to have four walls to do some really, really interesting stuff. It sure helps to have a good, safe, comfortable space. But if not, you do what you can. I want to ask Native Roots Radio if they happen to have another radio spot that we could queue up here and just get another taste of the We Can Do This Indian Country campaign. Native Roots Radio is our media partner behind the scenes. G&G Advertising is the creative force around the Indian Country ads, which you can find on the wecandothis.hhs.gov website, and you scroll through that and you can click on some of the Indian Country ads, including, I believe, that Superman spot we heard earlier. But do we have another radio spot that we can hear before we go to our next speaker?
For us, the circle is everything. Our ancestors survived by sticking together. Today, life is a bit easier, but our challenges are not. COVID-19, a disease that has hit our communities hard. Now, more than ever, we need to stick together and keep the circle strong. We need everyone, young and old, women, men, rural and urban. The circle calls on us to care for and encourage others. You not only have the voice to share your knowledge that vaccines are safe and effective, but the ability to help your family and your community members. It might be as simple as helping them to make the appointment or giving them a ride. It's our time to complete the circle.
We can do this. Go to vaccines.gov to find vaccines near you. Paid for by the U.S. Department of Health and Human Services.
Thanks, Native Roots Radio. That was perfect. Something about the voices, right? Just takes you there, takes you there. Not all of us live surrounded by our people and our culture and our family, right? So it's always nice to be able to podcast something or check this out that looks right. I was in the car today driving across South Dakota from the Twin Cities, and I had the radio off for the most part, just kind of looking around at, not much of anything. It was a cloudy day, very windy day, but something about those voices and the drum and the way we led this show off with some beautiful, beautiful music. I'd not quite heard that sort of harmony before with male voices. And let's bring in our next speaker, Chontay, Standing Rock. Tell us about that music that we led the show off with that you probably just did on your phone, huh?
You kind of broke up there for a little while. Can you repeat that, please?
Yeah. What's your style? What's your style of music? It sounds, it was very, very, it was kind of ethereal, right? It's definitely native. There's no doubt that it's native, but that harmony is something you don't hear every day. And I'm guessing that the technology, I don't know if those voices were all your voices, but I'm just curious, how do you do what you do with your laptop or whatever your tools are?
The music I sing comes from my music I sing comes from my Cree people, comes from a round dance ceremony. So these are round dance songs I sing. As a young kid, I just was very, very fond of the way of the ceremony. I was so attracted by the song and the drum. Then somewhere along the way, I got a hold of a recorder. I start recording myself, and I started to overdub and all that. And as of right now, I'm a music tech major at Montana State University Bozeman, and they taught me over there how to use this recording equipment. So I went ahead and I invested in my own recording equipment, and all of those voices you hear in my songs, they are me. And what did I do is I just record over my main track just over and over, and I put all these different voices in from high to low. And yeah, that's it.
Let me ask our folks at Native Roots Radio if they can play just 30 seconds of how we started the show, just to give people an idea of what you're talking about, and then we'll come back and talk more about it. Let's see what they can pull up. Awesome. So how many tracks did you have going, Chontay?
I can't remember exactly how much I had in that track, but normally I'd put like 6 harmonies in one track, so 6 voices in one track. And where I got the harmonies from actually is I grew up going to ceremonies, and I got to listen to some recordings from the Yankton Sioux people, from the Native American Church, Peyote Way of Life. Hearing their music and then hearing their harmonizing, like their harmonies, they really inspired me. Like, I'd like to do that on my own. I'd like to see like how I can include that into my own music, because it makes me feel good. So,
yeah. I was curious. I actually have people. Canoyer is a Yankton name, and my grandfather was one of many brothers. So there's Canoyers all over the place, including some of the elected leaders at Yankton. Where did your name come from? If you're Chippewa Cree from the Rocky Boy Reservation on northern Montana, sounds like you have a Lakota Dakota first name there.
Yeah, my mom named me. It comes from the Lakota people, Chontay. Yeah, meaning I believe heart. And then I heard from one of my white friends. They told me that my name actually means to sing in French. So.
You've got it covered.
Yeah.
How did you end up at Bozeman? I've never been there, but I know it's supposed to be a beautiful place. Quite a few Native students. There's MSU up at Havre too, which is a little closer to Rocky Boy. Probably no music program up there. What was it about Bozeman that attracted you?
A friend at the time, while back in like 2016, 17, told me about a music program down there. She asked me, "What do you want to go to school for?" And at the time, I wasn't really planning on going back to school. And she told me that they have this music program, and I was like, "Well, I guess I'm going to school then." So. Yeah.
I heard about that new building they dedicated for some of the Native American student services, and I don't know what else is in there. What were you at that ceremony, and what's that building like?
I was at that ceremony. I was also a part of the planning for the building as well. The ceremony for that grand opening on behalf of the American Indian Hall was great. It was fantastic. The university invited myself to go down there and sing for the grand opening, and they told me that I will be singing for all these dancers, and I was like, you know what? I don't think I'll be able to do it alone. I'm going to bring down my family as well. So I took down some of my brothers and some of my uncles to help me sing. And that building is very great. It has a room specifically for singing, and for smudging, where we can hold like little ceremonies and things like that. So yeah, it's a really great building.
Well, it's nice that you were part of the opening there. I didn't realize that. I just was communicating with a friend of mine. You've got to look him up. But when you brought your family down, I guess that's your way of layering them in under. You couldn't like duplicate your own voice in the moment, so you had to bring in the real thing, huh? On other tracks. Yeah. Check out. I don't know how much he's hanging around the university or not, but I'm gonna bug him after this conversation. But Joseph Gaughan is from Fort Belknap, and he was at that. He just said that he was at that ceremonial opening of that new building. He's on a sabbatical, hanging out in MSU Bozeman, but he's from Fort Belknap, and he teaches back east, and psychology professor. Very interesting guy. I don't know other Montana State people. Wayne Stein was there for years and has retired, probably ahead of your time. I forget what reservation he's from. Fort Peck, maybe. Anyhow, thank you so much for joining us. Your music is fascinating, and I'm just wondering before we end, what's the pandemic been like for you and your family and the last year plus? I don't know how it impacted school, but what's COVID been like to you?
I caught the virus in late December, and it was rough. It was really rough. I lost my taste. I lost my smell. That first day, I lost my balance. As for my family, we have been keeping as safe as we can. Not a lot of my family members have caught the virus. Majority of us, my family, we are vaccinated. There's only a handful of my family who have caught the virus. And as for the community, there has been some deaths. I guess all I can say about that is we're doing our best.
Yeah. Well, glad you recovered, and hope your family stays well. Hope Rocky Boy stays well as a community.
Mm-hmm.
And really appreciate you and your music. I'm a little jealous, I'm a recovering TV person. I guess I'm still doing TV here, but a little over the hump. So really listening to you. I have my little Zoom recorder. I don't know if you use Zoom to record some of your tracks out in the field, but it's just amazing what technology and creativity and indigenous thinking can do. So do you have CDs out there yet or anything like that you want to talk about?
I do have an album out that is on Spotify, and it's on iTunes, and I do believe it is now on all music platforms. So you could search me up on YouTube. You can search me up on SoundCloud. My album is out there, and actually, after this event here that's going on now, I will be starting my second album, A Song for You. Yeah.
Nice. So we just look up your name, Chontay Standing Rock, and it'll take us there?
Yep.
Chontay.
Mm-hmm.
Cool. Well, this has been, I don't know if you were going to maybe give us another little sample of your music as we close. Was that the plan?
Yeah.
Okay. Well, I just want to thank everybody for joining us. This has been a great conversation, and we're going to do another one of these in a couple weeks. And I don't know, maybe Chontay will come back. The We Can Do This Indian Country campaign. How do we have a conversation about the vaccine, about masking up, about staying safe, about staying vigilant, right? It's a tough virus, right? And we saw Dr. Anthony Fauci, it's a horse race, and we've got the vaccine, and we have now therapeutics that if you do get sick, there's therapeutics that are coming that can make those symptoms not so tough. So we have the tools, and how do we stay on top of it in terms of information? Go to vaccines.gov. We can do this.hhs.gov. But thank you for joining us on a Friday night. And to take us out, Chontay, the platform is all yours. Thank you for being with us.
You're welcome, and thank you for having me. I'll go ahead and sing a couple verses here. And hey,